Good afternoon. Today we're here with Dr. Ambler, and she is going to be discussing and answering questions about autism spectrum disorder.
Hi. Hi, I'm Dr. Denise Ambler. I'm a child and adolescent psychiatrist. I'm currently with Meridian Health Services. I've been in practice for about 17 years now, and I work with kids of all ages, and in a good percentage of the population I see have autism spectrum disorder.
Well, thank you for being here with us today. What are the main characteristics of autism, and what does it mean to be on the spectrum?
Well, autism is a complex developmental disability. Signs appear often in early childhood, and it affects the ability to communicate and interact with others. That it can affect individuals to different degrees and varyingly. There's no one single cause, which is why we call it a spectrum, because there is a variation of impairment that can occur. The main issues in autism spectrum are twofold as they are currently diagnosed. One is a deficit in social communication and interaction. For example, you may have a child who makes very little or no eye contact. Or you may have someone who has a lack of interest in peer relationships, someone who, as educators, should be well beyond parallel play and now still sits alone and is engaged only in their activity of interest. Alternately, you may have a child who has trouble modulating their self to modern social cues. For example, not using their outside voice in the library. The second aspect of autism spectrum disorder is restricted and repetitive behaviors or interests or actions. And this can be also in varying different degrees. Part could be due to motor issues. You may see kids who, when they get very excited, they flap, which may be normal in a very young child, but as they get older, we notice this is not in the realm of typical behavior. Another instance of motor impairments that you may see in autism is rocking back and forth or spinning when a child gets very excited. Another way we look at the restricted or repetitive movements or behaviors is an insistence in sameness. They have a very high fixation to particular routines. Things that you or I could change quickly, they will become very upset or have the typical meltdown, as it's often called, when that structure is changed. Also, the other way this restricted or fixation may occur may be in regards to interests. They could be every topic revolves around dinosaurs, and we'll go back to dinosaurs. Other children will say, hey, let's play something else, and they'll come back to wanting to play the same dinosaur game. Lastly, you may see some hypo or hypersensitivity in regards to sensory issues. A child may not really understand they need to put on several layers of clothing when it's cold outside, or similarly take it off when it's 80 degrees. A very typical way we see the sensory issue is difficulty with excessive sound. Excessive sound will cause them to cover their ears or hide or even go into a meltdown or negative behavior. So.
Thank you. How has the revised diagnosis of the autism spectrum disorder impacted the criteria for meeting the standard of autism spectrum disorder?
Okay. So the DSM, or the Diagnostics, the DSM, or Diagnostic and Statistics Manual, came in DSM-4 and DSM-5. DSM-4 was used until recently, and autism at that point was categorized by 3 separate specific criteria. One was social interaction, and the next was communication, and the last was restricted patterns of behavior. Now, as of May of 2013, DSM-5 came out, and what happened is they took away the specifics of the communication issue and integrated that to social communication and social interaction. This effectively eliminated this need for the language delay, and the effect is decreasing the comorbidity with intellectual deficits. So what happened was basically anyone who had the prior diagnosis of Asperger's disorder, pervasive developmental disorder, Rett's disorder, or childhood disintegrative disorder, some of the more rare things that isn't seen in a typically developing classroom, all became combined under autism spectrum disorder, or one label or diagnosis. So, and in some studies that showed that if they took those with the autism diagnosis and tried to retest them under from DSM-4 criteria to DSM-5 criteria, basically 83% of the people would continue to have that same diagnosis, and approximately 14% of people would have social communication disorder, which is a disorder that includes much of what we just discussed with autism spectrum, but separates out the restricted and repetitive behaviors and movements. So it's just the social interaction piece there. They would get that new diagnosis.
Thank you. What are the best methods, both scientifically and medically, of diagnosis of autism spectrum disorder and its many counterparts, such as Asperger's syndrome?
So, interestingly enough, the first stage of concern for autism is usually about 17 months. And so there's a big push now, and I know where I work at Meridian Health Services, they're also doing a lot of more screening. So the first people to likely pick up and diagnose the autism spectrum disorder would be the pediatrician via these screenings that are done between birth and 36 months. But for older children, the diagnostic evaluation is the gold standard. Ideally, you'd have a multidisciplinary team where you'd have a pediatrician, a speech-language pathologist, an occupational therapist, a psychologist, and a psychiatrist all working together to evaluate a child. And we'd be looking at for a diagnosis based on the analysis of all the behaviors and their severity. But unfortunately, that only exists in certain, usually academic centers, that you can get that full gold standard diagnostic evaluation. However, we still can do a decent job. We would like to do a history and a physical exam to rule out any medical issues that could be perhaps causing the symptoms that we see. We want to do an audiology or a hearing screen, as well as a vision screening, making sure that hearing deficit isn't the reason why the child is not communicating. Ideally, we'd like to have an EEG, which is an electroencephalogram. It's when they put all those little fun stickers on your head and you wear that fun helmet. And because up to 32% of the children with autism will also have seizure disorder, which can affect even their prognosis and learning going forward as well. Laboratory work, including a full genetic workup, is becoming more and more the norm. We especially want to test for Fragile X, one of the known causes of autism, and that will give us also prognostic features by knowing what's going on. The blood level is very important, and sometimes does get missed. Possibly, again, usually seen in one of these more gold standard evaluations, they will do what we call an autism diagnostic interview, which is the ADIR, or the autism diagnostic observation schedule. These are very in-depth testing measures that usually take place in a research setting. However, there are less extensive instruments that might also be used. The checklist for autism in toddlers, the MCHAT, the Childhood Autism Rating Scale, the CARS, the PDD screening test, the PDD-ST, and I'm sure many others will now become developed with the slight changes that we've had in the diagnoses. Ideally, also, you want to do an assessment of intelligence and achievement. But with children in the autism spectrum, because communication is such an issue, it's really considered standard to try to use some sort of nonverbal testing, if possible, to get a true IQ. And this would include something like the Leader R International Performance Scale. And as of course, because there is some comorbidity with intellectual deficit, which we used to refer to as mental retardation, you do want to do some kind of adaptive functioning testing as well, so you can figure out if there are learning disabilities, which there very well may be. So something like the Vineland Adaptive Behavioral Scales should be done. So.
Thank you. In what ways can teachers and professionals best work with a child who has met the criteria of autism spectrum disorder?
Well, I think first coming to the acknowledgement that people with autism spectrum disorder generally can't understand other people's thoughts and motivations is kind of a key tenet for developing strategies for working with a child with autism. So because they can't understand that, they often can't respond appropriately to their environment or form relationships with others. And because of all, you put in place also the language delays and or intellectual disabilities or learning disabilities that might occur, they may have difficulty communicating their needs. So visual aids are very key, I think, to help the child better understand when materials presented visually versus orally. Visual schedules that are very concrete, that are posted about the classroom can be helpful as well. What to prepare for next decreases the stress in the child. Structure and routine. Structure and routine. Structure and routine. If there's one thing I say a lot in my interactions with patients, it's that. But every child benefits, but kids with autism thrive. They don't cope well when changes are made, or transitions are particularly tough. So giving timetables and steps for changes are important. Another suggestion is working in pairs with another child. This gives a chance to practice the language and communication skills as well as modeling. I would suggest, however, though, having it be more than one child that they're paired with, because if that child's absent, or it just may place an undue burden on the child that is being modeled. And it also gives opportunity to learn different modes of communication from different sources. A teacher's aide is often suggested because they can elaborate on what the teacher is making directions more one-on-one with the child in need. There are some that say that this can cause the child to become overly dependent because they have that, but I think at certain stages that can be, and for kids who are maybe more severely affected with autism, that could be essential for keeping them in a more inclusive classroom. And of course, the individualized education plan is, I think I'm preaching the choir there. But when I say that, I really have to put in part, flows into the next set of ideas I have, but learning from the learner, because each individual, as we started talking about, is on a spectrum, and it may be affected differently. And learning from both the parent and the student what benefits them. So not every kid is going to need every accommodation that is available. Some may need very little, and some may need quite a lot. Again, supporting transitions is key, giving 5-minute and 1-minute reminders to changes, and providing maybe the student or the whole class with these reminders so they're not singled out. Having a partner that moves from place to place with them, or even carrying an object to facilitate movements from place to place may comfort the child. Fidget supports, which I'm sure you all are very familiar with, a piece of fabric, a ball, the ability to doodle may keep the child occupied and more actually on task. Help with organization is often necessary. Maybe having everybody in the class do a 2-minute cleanup, or do something between transitions, like everybody writes down the next homework assignment at that particular time. And providing checklists around the classroom in, again, a visual and concrete manner, like this is what we make sure we have in our backpack, or this is what we do before lunch, or this is how we wash our hands, to make it very clear so steps aren't missed. Signing class jobs can keep a young person busy and feel like they're very much part of the classroom and give them a sense of pride. Providing breaks, even if simple as getting up, standing up, walking around their desk a couple times. Sometimes more is needed, like a cool down place. If they get the sense that a meltdown is approaching, having them go off to that quiet and less sensory overloaded spot. Allowing focus on interests. So, for example, if they have to do a report, they're allowed to do it on trains, even if they've done 4 other ones on trains, but maybe a different aspect, but allowing them to expand upon that fixated interest with the curriculum focus that you have. Rethinking writing is important too, because a lot of times the occupational therapy aspect is also a key part of this population. Just the forming of letters can be very difficult. The child may be able to produce the information, but just not be able to do it in a motoric manner. They may do better with either a computer or having a scribe for them. Okay. And giving choices is, as you probably already know very well, something again, and again including the child so that they can observe and learn from their peers.
Thank you. How can a teacher or professional best help and support a child with autism spectrum disorder in the classroom in practical ways? And you've shared quite a few of those. Is there anything you want to add to that?
Well, all I would say is that, a lot of times we talk about explosive or aggressive behavior with children with autism, and so I think looking back at the ABCs, basically, what is the antecedent for the behavior, what is the behavior itself, and what is the consequence, and just making sure we're not rewarding the behavior, and looking at what is it that is stressing the child, and getting them to the point of having the behavior, so maybe it can be avoided in the future, and make sure we're not inadvertently reinforcing it. I think that could be helpful as well.
What is the future of autism spectrum disorder?
Well, if I had a crystal ball, I think there's a lot we have yet to learn about autism. First off, there's very little we know about autism in adults and older adults in this particular. I think we are going to need to learn a lot more about how to help our young people transition into adulthood and be as independent as possible. The other aspect, though, I think that we're going to see a great deal of change with autism is in genetics. I think we're going to learn more about the potential causes. We do know that there are a few causes that are like clear genetic links, but a lot of times it's multifactorial or epigenetic is the new keyword is. But having that information will help us make better treatment plans, hopefully come up with better medications, and a better prognosis.
Thank you for being here with us today. We appreciate your willingness to help.
Sure.
Thank you.
Thanks.